Well, good morning, everyone. My name is Patrick Kelley. At the Institute of Medicine, I direct the Board on Global Health and would like to welcome you to this meeting of the Forum on Global Violence Prevention. The Forum on Global Violence Prevention has been meeting now regularly for about 5 years. It grew out of a recognition that violence is an underappreciated cause of morbidity and mortality. Morbidity and mortality to not only individuals physically, but also psychologically, also spiritually. It's not only a cause of morbidity and mortality for individuals, but in many ways, families, communities, even whole nations suffer the burden that violence causes. The forum was really created to look at cross-cutting aspects of violence prevention across the 7 WHO categories of violence, going from child abuse to elder abuse, intimate partner violence, sexual violence, youth violence, collective violence, and even self-directed violence, including suicide. We really try to look at those topics in a cross-cutting way. What can we learn from each other about common risk factors, about common interventions? Now, for this workshop, we're going to be looking at the social and cultural norms associated with violence prevention. Unfortunately, violence is normative in many settings in this country and around the world. And we have to change those norms. And we want to, over the next 2 days, learn more about what can be done to change the norms that appear to make violence tolerable in so many parts of the world. I wanted to thank several people for helping to put this together. The forum's director is Louise Flavahan, and she and Allison Berger are over there out in the hallway, are really the ones who manage the forum on a day-to-day basis. Our current co-chair is Professor Shelley Greenberg from Johns Hopkins University. And I also want to thank the planning committee, and they'll be introduced later, that put together such a wonderful package of presentations. This is going to be, though, more than presentations. There'll be ample time for discussion. The meeting is being webcast, so people all around the world are able to not only watch this live, but also view the archives after the meeting. The presentations will also be, the PowerPoints from the presentations will also be posted on our website within a week or two after the meeting. So don't feel that you need to capture every nuance in your notes. You'll be able to go back and review the videos when that's desirable, share the videos with your colleagues, review the PowerPoints, share the PowerPoints with your colleagues. So on that, I'd just once again like to extend to you the warmest welcome possible. I will just note very briefly that I said I'm from the Institute of Medicine, and you'll see on the slides we use the logo, the National Academies of Sciences, Engineering, and Medicine. That is the overarching organization, the National Academies of Sciences, Engineering, and Medicine, and the Institute of Medicine is the health-oriented operating arm of the overall National Academies. I just mention this because this change in logos and titles occurred a few months ago and has led to a fair amount of confusion. So some people will say the Institute of Medicine has gone away and become the National Academy of Medicine. We're still alive and well. We just now have 2 dimensions to ourselves, an academy with wonderful members, such as my friend Dr. Campbell here, and a staff group with wonderful staff such as Louise. Thank you.